Thank you for joining. So today we're going to talk about fluctuating pain with changing season. So
Right, you might enjoy this, Mike. Fluctuating pain as seasons change.
So, just a brief intro about me. So, I'm a physical therapist licensed in Washington, California, and Massachusetts. I have received my geriatric clinical specialist and primarily specialized in working with movement disorder group, mainly Parkinson's disease, functional movement disorder, pain neuroscience. And I'm also working with digital health startups and helping design some new innovative apps and other applications. So at BeyondRehab, I work primarily through specialty care programs for Parkinson's disease, also offer personalized care and wellness assessment for the community, Parkinson specific community. So during our talk, I'll divide that talk into three parts. So the first is just understanding the seasonal change and its perception on our body, on our pain experience, and how does the change in season affect the health and pain experience, body changes. Followed by it, we'll discuss about the recent evidence and the study findings, and we'll end with the tools and strategies to manage the seasonal pain and ways you can continue working and finding ways to better cope with the change in weather pain. So what is weather pain? So there's been a term labeled as weather pain. So the weather pain, it's more weather-related pain is a phenomenon which occurs primarily with people with underlying condition as arthritis or limb injuries, and they see the change in their pain with change in the weather-related change, more of the pressure, humidity, and other weather factors. There's been a common quotes like aches and pains, coming rain, feeling under the weather, ill health due to the evil winds. Those have been commonly used by our ancestors, and that's how it's been described, the body functioning with the change in the weather. So the age-old understanding of seasonal effect on pain. So weather has been thought to affect the symptoms in patients with a chronic disease since a long time. And many reports the pain is made worse by cold rain and low atmospheric pressure. On the other hand, people also report that warmth and high humidity also affect their pain or just their body functioning. So there's been a huge spectrum of how people have the effect of change in the weather on their health. And particularly, almost 3/4 of people with musculoskeletal conditions believe that weather influences their pain. It's been a big factor on all of us of how weather impacts the overall functioning. So as we are understanding, like, it's well known, like, okay, this weather definitely has some impact on our day-to-day functioning, on how our body works. So now understanding the components of weather, each component of how it influences the body, our body. So the first is low temperature. So the temperature drop is related to is supposed to increase the viscosity of synovial fluid and change the compliance of periarticular structures, making the joint stiffer and more sensitive to the pain and mechanical stress produced by activities. So there's been modest evidence of association between the temperature and chronic musculoskeletal pain, with evidence for partial, again, it's again mediated by other factors. This was from one of the studies, followed by the humidity changes. So as bones, muscles, tendons have different densities. So humidity changes have also found to affect the expansion and contraction of these tissues. So increase in relative humidity also increases the probability of reporting moderate pain. The barometric change, there's an extreme change in the barometric pressure, which can influence the inflamed joint to swell more and have more exaggeration of the pain experience. One of the studies suggests that the dropping barometric pressure impacts the synovial fluid, and and also changes the response to the nerve ending. So there's the pressure impacts the pain responses of the nerve endings. We have these mechanical receptors around the joint, and that gets impacted with the drop in the pressure, and that influences the pain experience. And the last one is the wind change. Increase in wind speed increases the probability of reporting moderate pain. Again, it's not very clear yet, but these are the key components of how like temperature, pressure, humidity have an influence on our body tissue, on our synovial fluid, and how it impacts the pain experience. So one of the other factor is like with the changing weather, there's also the change in the activity level. So if you notice in summer, everyone's super active, you're outdoor more, you're really moving in all various ways. Then as you see that there's a slowdown in the activity level with the change in weather. Fall, winter, especially in winter, it's more indoor activities. And with the change in the activity level, there's an impact on overall body functioning. And since the decrease in the exercise also impacts your pain experience, and together associated with the sun, right? Like the sunlight decreases, and it has an impact on your mood. So less opportunity to be outside, less opportunity to be in the sun, and have an impact on overall your mood and function. So these are the two other key factors which also influences the pain experience along with the weather change. Again, it's not directly clear which one influences and how it influences, but it's been well noted, the changing weather and its impact on activity level and the mood. So this was all like, understanding at different levels, different components of how the weather's impacting. Now I'll be going over the studies and understanding, like describing what all studies have been done in this domain. So studies on the weather impact on pain and health. So one of the studies was done in UK, and it was a really longitudinal long study, and it's been done for more than 6 months. So in that study, they recruited almost 13,000 patients across UK for 15 months. And participants with the range of underlying conditions tracked their daily activity levels, daily symptoms for 6 months. And based on the findings, the study demonstrated that weather sensitivity among patients with chronic pain is a phenomenon more apparent in some subgroups versus the other. And also, in addition, amongst those sensitive to the weather, the direction of the weather pain association may differ. So it wasn't very conclusive. It was more like, all they noted was there's higher sensitivity in some subgroups of individuals, and they had more like higher, more sensitive to the pain, overall pain experience as compared to the others. The other study was more narrative study, and it was just primarily focused on understanding how the weather conditions associated with chronic musculoskeletal pain. The aim of the study was to identify and synthesize the study's association between variables and chronic pain in people living with musculoskeletal condition. So what they found was that the review shows that the association between the weather and pain has been very difficult to characterize, and there is a lack of consensus on the existence of an association between the weather and pain, and lack of theory as to how weather may influence the arthritic pain. So this was more from the chronic pain standpoint. Now moving on, also understanding, okay, when it comes to Parkinson's disease, is there any changes specifically weather related, which impacts the Parkinson's disease? So one of the studies was done, and in which the motor scores, as defined by the Unified Parkinson's Disease Rating Scale, it's one of the standardized scales, it was recorded, and it was compared in various months of the year. So they noted no difference throughout the year. The second study which was done, It was mainly tracking the prescription of pain medication. So they analyzed the pain medication prescription in the winter and in the summer month. So what they noted was more PD meds were prescribed in the winter months, suggesting that there's a variability in the PD symptoms depending on the season. So again, this was all like not very conclusive, and you couldn't find any link or couldn't draw any conclusion. So it was just what all findings we have. So as you know, like, the results from all of the research studies are not very clear. It is certainly possible that some people with Parkinson's disease or with chronic pain may experience a variability in their symptoms as it relates to the season. So it's definitely, there's a high probability, there's that everyone might experience pain differently, and you might have more sensitivity to pain with changing weather as compared in a regular scenario. And if you see like your pain is varying based on changing season, then maybe it's good to have a discussion with your doctor, make adjustments more in regards to Parkinson's disease. If you have like fluctuating symptoms, fluctuating pain experience, then that will be a good standpoint to have a discussion with your team, make adjustment in your treatment and lifestyle depending on the time of the year. So this was all to summarize right from the historical standpoint, how things, as a community, definitely everyone notices that there's pain is a huge factor influencing our day-to-day functioning with change in weather. And definitely scientists are trying to track it, find ways on how can they find a correlation between weather and pain. And but it's just because of the heterogeneous nature, so many variables impact pain. And again, weather, it's dependent on so many other variables, so it's hard to come to any conclusion. But this has been an overall understanding of how specifically how each component, temperature, pressure, humidity, wind, have an impact on our joints. So at times people have also called it as microclimate changes happening around our joints. And based on the microclimate changes, the body has a different different response. Like the viscosity of the fluid, like the joint fluid changes, and that makes your joints more stiff. The other is the nerve receptors are more sensitive with the drop in pressure, and that exaggerates your pain experience. So different theories have been proposed and has even been validated to some extent, but again, not yet very conclusive of what is causing what and how things are triggered. So now here comes the key role. Like, okay, this has been the background, this is all we know, this is what the research people have come up with and clinical findings are showing. Now what do we do? What's the action plan for this change in the weather? So I really like everyone, if you have a pen and paper, to do this together. So after this lecture, you'll have a you'll have a game plan to work with and to reflect on with time. So how do you prevent and prepare for this change in season and the weather and the pain associated? So one of the effective ways to cope with the weather associated pain in general, it's, for everything, right? Like embrace a healthy lifestyle. So really look into healthy eating. And it's recommended that anti-inflammatory diet is beneficial to decrease the inflammation. So it comprises of decrease in gluten intake, decrease in dairy, decrease in sugar, and processed food. I know it's too broad, but if it's of an interest to you, I'll definitely suggest look into it more. And if you think you want to connect with a nutritionist who is more, proficient in advising and recommending, do that. It plays a key role. Second is mindful practice. So mindfulness practice more in the form of formal or informal So if you're into like using an app just to do a regular meditation, good. If not, just doing like informal mindfulness, more like when you're going out for walking, you're in the moment, you're having like a set breathing pattern. There are multitudes of ways which you can engage in mindfulness practice, like body scanning, moving, whatever works for you. Discover and see how you can regularly practice it on a daily basis. Work on optimizing your sleep. It really has an impact on your overall health and pain. Second, like, as you see, like with the weather changes, like your activity will change, right? Like if you're into more into the outdoor walking or meeting friends in the garden, that might change, especially in the coming months. So start looking into what are your other activities which you want to engage in this coming season, and start preparing for it, because it's been well proven that with the help of distraction, your mind is better equipped in managing it. Like if you're not able to problem solve of how is the pain experience happening, it's more of more of a freezing mode where it's difficult for you to think. So well in advance, like have some activities for you to engage in more in the form of distraction and which you really enjoy. So this will be a good win-win situation. You get to do what you like, and also you get to distract from your pain experience and cope better. And continue finding ways on how you can enhance the healthy coping strategies that work for you. Try connecting with other people and folks, doing something winter theme event, or maybe indoor gardening, cycling, whatever works, so that you continue with your activity level, social engagement, and having more ways to, be be more creative, more active. So, and it's recommended that if you have a set of self-care routines, specifically in the winter, continue doing it. Probably hot water showers helps you. It helps just to loosen the stiffness. Going outdoors when and where possible and safe to capture the daylight. Using heating pads just to relieve the muscle spasm, um, improve the circulation. Heated weighted blanket, it's good. It helps with the joint proprioceptions. It helps with overall calming of the nervous system, basically the parasympathetic nervous system. So any time of the day when you feel pain is really exaggerated because of too many like other conditions, other things happening around, weighted blanket will be a good addition in your toolkit. So see if that works for you and try it on. Definitely, heating pad is easily accessible for everyone. So keep that handy. So anytime you feel it, so, use it and see how it works for you. I know someone asked a question about hot water showers. So it's recommended specifically because it helps you decrease the stiffness, and helps you improve the mobility to some extent. I've also noticed people do more of hot yoga, like they have this hot room and they practice yoga, and it helps their joint. If that's something of an interest to you, try it out and see. Again, there's not research done on it yet specifically. So it just depends on how's your experience. Any questions so far? Yeah, Lauren.
You're doing 2 out of 3 right there.
Oops, I cannot hear you. Try it again. Oops.
Okay, now,
Yes, thank you.
if the barometric pressure can change the viscosity of the fluid around your joints and things, do you have any idea if the changes in barometric pressure can affect the fluid in your brain? Because there's a lot of fluid there too, right?
Yeah. I mean, I haven't read any studies on that. It was all more related to the synovial fluid so far they have come up with. But yeah, that's something of curiosity to me too. Like, how will that change the
I
brain?
swear it changes things.
Have you noticed change in your like any of your cognitive thinking with weather? Is that
Absolutely, but I'm kind of the opposite of everything. So I live in Southern California, and in the summertime when it's really hot, that's when I do my indoor activities. Now that the weather's cooling, I'm outdoors and I feel much better in like a temperate climate, but in the extreme of heat, I'm very, very miserable.
I see. Yeah, Shelley.
I do have a little bit of information. My ENT, who deals with my sinuses, tells me that when barometric pressure goes up or down, the fluids in your sinuses will get thicker or thinner depending on where you are in the continuum. So if you've got fluid in your sinuses or behind your eyes, I bet you dozen donuts, your brain's just swarming in it.
2 out of 3.
Interesting.
So that's all I know.
Thank you. Yeah. So something to continue tracking and monitoring how it influences. And again, everything is dependent. It's an experience as in whole, like just the pain experience or anything changes. So it's hard to have like a direct correlation. So again, now the key going to the exercise piece. I know everyone has a set exercise routine. Just want to revisit the simple concepts. So especially during the winter time, make sure you're having some time to stretch your muscles in the morning to avoid the morning stiffness. It can be simple rhythmic movements, yoga practice, tai chi training, anything which works for you to loosen the joints, to improve the mobility, and to help you, better prepare the muscles for moving, strengthening, and other functional activities throughout the day. Continue with the strengthening training. So, typically with the change in weather, it's difficult to keep up with the exercise routine. So if you think, certain time of the day, maybe afternoon is best with the weather being okay, try it out, try look into the time of the day which works for you, and regularly engage in the strengthening exercises in the form of body weight training, boxing, weight training. So this way you continue keeping up with your muscle strengthening, preparing the muscles and strengthening and working hard. Aerobic training is also crucial. So again, it's tricky, right? With the shorter days and less daylight, how do you do it? So maybe indoor walking, cycling, dancing, see if any of that interests you. And if it does, then making sure you regularly repeat. If you think doing it with the group, connect with the group, regularly do it and see how it goes. So it's really a good time to reflect and see, if you have this set routine, which has been working really well for the summer and the fall, now how do you translate it for the winter? If you've been doing more of walking, like 60 minutes a day, twice a week. So how do you do it in the winter? Is it still okay for you to do? If not, what are your other options? So take some time to see how the new exercise plan will look. So as you're understanding, everyone has a different perception, different experience with the change in weather. It's also equally important to monitor our performance daily and reflect on it. So how do you do it? So as you know, it's not just the change in weather which influences your pain. There are so many other associated factors, right from sleep, activity level, your mood, your prior, the weak level, were you sore to injured? So the entire picture will help you determine how's your overall response with the change in weather. So in order to do that, I was able to create this just a quick symptom tracking list. So if you can, for a couple weeks, just note down your pain severity, your fatigue level, stiffness, impact of pain, how much is your pain interfering in your day-to-day function. In general, your physical activity, your mood and sleep. Keep a track of it for 5 days, and then you can easily correlate, like this week, it's sunny, your numbers are really good, best. And if you see change in the number in the next week, and then you can compare and reflect, what can you do differently? What's working, what's not working? Is it your fatigue level? Is it because you're not sleeping well, or you don't get more chance to move, go outside or move? What's interfering, and what are your options? What can you do to better cope with it? So it will take some time, but definitely tracking will be a first step to begin with. I'll email you this checklist. If that's something works for you, then just put it on your refrigerator and daily track it. So as you are understanding, learning how your body is changing, adapting to the weather, like you to put down like a list of things which really works well for you. So, if you think there are certain stretches, certain moves which helps you relieve your hip pain, your joint pain, keep that handy, stick it, have a picture of it on your phone. So anytime when you are in discomfort, or anytime when you experience more of a flare up episode, so that's when you can refer like gentle moves which you can do, revisiting. It's ideal, like, to distract the mind, to help you better cope with it once you are able to relieve the pain in the form of either. So going back, so anytime when you have a flare up episode, the best way to do is just assess your condition, see how is it, and if you think it's a one of the normal phenomenon which occurs and it takes time to settle down, so how do you go with that? How do you manage that time frame? So start with simple relieving the joints, just doing the gentle moves, using heat packs, and see how that goes, followed by some simple distraction tools like, reading a book, revisiting some photos, CDs, fragrance, which helps you relax the mind, which helps you uh, have more of a calming effect on your mind, and slowly better cope and gradually manage it. So it's not going to be instant. Like, you'll be like, it doesn't make sense. If I'm in so much pain, why do I like look at a book or a picture? But all we are doing is trying to have a calming effect on your mind. So meanwhile, you can work on, the body can prepare and work on better coping and problem solving. How do you handle the pain experience? How do you better manage it? So in order to do that, really start noting down, like, quickly, whatever is of an interest to you. If you are into reading, just put some key books out on your table. So if you are not feeling well, something, you can just start, like, maybe look at the cover or read one page and see how you feel. Having some activities for you to do, like in the form of stretching or any other tools, painting, and see if you can engage just for a short time and see how that goes. It may work, it may not work, but it's as simple as it sounds. And it's all you have it's just like the matter of putting it out and getting it into a rhythm and practicing it. So that will help. So continue tracking, continue monitoring, and that is the key. And as I said, I'll share the symptoms page with you. This is all I have from the pain side. If you have any questions, I'd like to hear from you.